During sickness exams and receiving a diagnosis, building a relationship with your primary care team is very important. Dr. Mark Meeker, Vice President of Community Medicine, joins us now to tell us more. Good morning.
Good morning.
Thank you so much for being here with us. So we want to know the term primary care provider or physician. We hear it very often. Do you mind defining that for us?
Sure. The term provider has kind of infiltrated the lexicon from the insurance industry. Provider is kind of all-encompassing, includes physicians, advanced nurse practitioners, and physician assistants. And the primary care part of that is the team that's primarily in charge of the patient's health and health care. So the primary care team is trained to do health and wellness, routine physicals, immunizations, health maintenance issues, screenings, that sort of thing, but then also to diagnose and treat illnesses. And then if a diagnosis and treatment of an illness gets to a certain level that needs more specialty expertise, then we consult our specialty colleagues to help us.
That makes sense. And I've noticed myself, even with going to the doctors, I'm hearing the term provider, and I'm like, oh, okay, this must be a difference.
Yeah, there's different levels of training and different skill sets developed. Physicians obviously go to medical school and then do residencies. Nurse practitioners go to additional training after nursing school, and PAs go to a specific school for physician assistants. So different levels of training, but the advanced care or the advanced practice nurses and the PAs assist us in taking care of the patient.
That makes sense. And as technology changes and telehealth is becoming more common, what is a medical home?
So the medical home is a term that was described by the Centers for Medicare and Medicaid to develop a term for the team that's, again, the primary care team. So the medical home is like a clinic where you have a physician, maybe a nurse practitioner, nurses, nursing assistants, front office staff, maybe embedded behavioral health and social workers to give that team-based care to the patient to help them navigate the healthcare system. So the medical home is where the patient should go for all of their needs, and then that team can help them attain the services that they really need.
And why is it important, really, to have a medical home for yourself that you can turn to?
Well, the medical establishment is very complex. It's a very complex system with, outpatient centers and hospitals and offices and clinics and various specialties and different aspects of healthcare. So it can be very difficult to navigate that efficiently if you don't have a medical home to help you navigate that. So the primary care team is really there to make sure you're getting health maintenance issues that you need done, to give you advice on what specialty services you may be needing, and then to help you navigate through that system.
So who should discuss advanced care with their primary care physician?
Advanced care planning is really important for everyone. People think of it as being a no-code or a DNR discussion, but it's way beyond that. Advanced care planning is really about the goals in life of the patient, and it's developing that relationship between the care team and the patient to decide what's important to them, how do they want things to unfold in their life, and how do they want to be taken care of should something big happen.
It's very important there. And in that case, how does decision making work?
Well, the term that we use is shared decision making, and really what that means is it's about a relationship. That's what's so important about primary care, is developing that relationship between the person and the doctor or the APN to really share in the decisions, give them the education they need to understand what they're dealing with, what their options are, the pros and cons of the various options, and then helping them come to a decision about how they want to approach their issue.
That's very informative there, Dr. Meeker. Thank you so much for sharing a little bit more about these processes and just different terms that we hear every day.
Well, you're welcome.
We'll be sure to have the resources that you discussed on our website, 25newsnow.com, and you can find more information on OSF Healthcare at osfhealthcare.org. We'll be right back.